Good afternoon, everyone. Thanks for joining the 2023 MIPS Improvement Activities and Promoting Interoperability Performance Category Overview webinar. During today's webinar, CMS subject matter experts will provide more information about meeting the requirements for the improvement activities and promoting interoperability performance categories, including participation basics for the different performance categories, reporting and scoring requirements, and resources and support. Presentation will then be followed by a Q&A session where attendees will have the opportunity to ask questions via the phone and through the Q&A box. And the CMS's subject matter experts will address as many questions as time allows. Also to note, a slide deck and recording from today's session will be posted soon. So with that said, I will now turn it over to Katie Moore from CMS to get us started. Katie?
Great, thanks, Matt. And good afternoon, good morning, everybody. Thanks so much for joining us today. And welcome back to folks who joined us a couple weeks ago when we kicked off this webinar series with a MIPS overview presentation. We should have those slides and transcript and or recording posted in the next couple of days. And then so today we're going to focus on the discussion on improvement activities, performance category, and promoting interoperability. So we have a lot of our wonderful subject matter experts on the line to answer any questions so that you can be sure to participate successfully in those performance categories this year. Next slide, please. Okay, here's just a quick rundown of what we're covering today. So I will cover just a few slides that give an overview of the quality payment program and MIPS, merit-based incentive payment system, just so we can give a little bit of background for folks that may be new to the program or haven't been able to join our previous overview presentations. And then we will jump into some more information about our 2023 annual call for measures and improvement activities. And then I will turn it over to our experts to talk through improvement activities, performance category, everything you need to know for 2023 related to that performance category. And then we will shift gears to promoting interoperability performance category. And then, as we always like to round out our presentations with some information on help and support and where to go to get some of the different resources related to today's topics. And then we should definitely have some time at the end for Q&A. So we can go ahead and get started. Next slide. And then also just wanted to point out in the chat function, throughout the presentation, our wonderful support team will be adding links as we're talking through things in there. So keep an eye on that. And then we'll get into more about the Q&A at the end, but the Q&A box is available right now, so you can start submitting questions. We'll try and get to as many as we can during the presentation, and then answer what we can during the Q&A session at the end. So here on this slide, just wanted to highlight a couple of our applications that are open and available right now. The first related to our MIPS Extreme and Uncontrollable Circumstances application. And this is available for individuals, groups, virtual groups, APM entities, anybody that is experiencing a circumstance outside of their control and need to request relief for MIPS for 2023. And I do want to highlight that it will be available for COVID-19, people that are still experiencing some hardship due to COVID-19. So the application is open now, and then it will be open through the end of the year. So you have plenty of time. December 31st is when that application will close. And then we also have our MIPS Promoting Interoperability Performance Category Hardship Exception application. And this is specific to our PI performance category, allows you to request reweighting specifically for PI. And then on our QPC website, where we have more information about both those applications, it'll give you more details on the specific criteria for each of those. So encourage folks that need some relief there to check out our website and the exceptions page for more information on how to get to the applications. Next slide, please. I'm going to have one more. So real quick, just a couple slides that I'm sure most of you have seen either in a previous presentation or in our resources. So the Quality Payment Program was established through the Medicare Access and Shipper Authorization Act of 2015, which we refer to as MACRA. And it established the Quality Payment Program, which is composed of 2 tracks. So there's MIPS, which is the Merit-Based Incentive Payment System. And then our APM, so Advanced Alternative Payment Models. And APM is just really a customized way payment approach developed by CMS used to provide incentives to clinicians who are providing high quality and high value care. And then we have another slide, I think maybe the next one. We can go ahead one more. That kind of lays out, sometimes there's confusion between, I'm in an APM, but do I participate in MIPS? Or so we put together this graphic to help explain that difference. So there are 2 tracks of the program, but as you'll see in this graphic, they do overlap. So there are some MIPS eligible clinicians that are participating in advanced APMs, but they're still required to participate in MIPS. And when does this happen? So if you do not have QP or partial QP status, then clinicians will be required to participate in MIPS. However, if you achieve partial QP status, you have the option to participate in MIPS. And then if you achieve full QP status, a qualifying APM participant status, then you are excluded from MIPS. Next slide, please. Okay, thanks. So for folks that are maybe new to MIPS, there are 4 performance categories within this part of the program. So there's the quality performance category, cost, improvement activities, and promoting interoperability. And clinicians participate in the program, and then during data submission, submit data to us or attest to participating in different activities. Cost, we collect that information for clinicians, so nothing is submitted to CMS for cost. We collect that information through admin claims. So each of those performance categories, depending on the data that's submitted or the information that we've gathered for different clinicians or groups, each of those categories receive a score, a number. And then each of those performance categories has an associated weight. So for 2023, in traditional MIPS, quality is weighted at 30% of your MIPS final score. Cost is also at 30%. And then improvement activities is 15%, and promoting interoperability is 25%. So that gets us to that 100% final score. And then also here at the bottom, you'll see a slight difference for APM entity participation, whereas in traditional MIPS, quality is 55%, cost is 0, and then improvement activities 15, and promoting interoperability is 30. Next slide, please. And then we also put a slide together for we get a lot of questions actually related to our redistribution policies for small practices. So we've updated for 2023 the performance category, those policies for small practices to more heavily weight improvement activities when other performance categories are reweighted. So here, when there is this redistribution for small practices, quality will be 40%, cost 30%, improvement activities 30%, and 0% for promoting interoperability. And then let's see at the bottom, when both cost and promoting interoperability performance categories are reweighted, then we will even things out at 50% for quality and 50% for improvement activities. Next slide, please. Okay, and then just real quick we're not going to get into too much detail about APP, which is the APM participation pathway. But we have a lot of more information on our website and resource library related to the APP. But we do want to flag that there are different categories, weights for those different performance categories. So 50% for quality, 0 for cost, 20% for improvement activities, and 30% for promoting interoperability. And Catherine, if we can go back to that exceptions application slide real quick, I just want to make a clarification. Back a couple more. There we go. Okay, I'm not sure if anybody is seeing the exception application screen. My computer may be frozen. But just wanted to clarify, we did say that the exception applications for EUC and for promoting interoperability closes on the 31st. However, we just realized that it actually is open until January 2nd. Thank you. So we'll get this slide updated for when we post it, but just so folks know, whenever a deadline falls on a weekend or a holiday, we typically shift the deadline forward to the next business day. So the deadline for these two applications will be January 2nd, at the same time, 8 p.m. Okay, great, thanks. Bear with us a minute while we get back to where we were. Okay, we can go ahead to the next slide. Great, thanks. This is just a quick timeline of the program. So as most folks know that have been in the program for a while now, our program overlaps. Different aspects of the program overlap different years. So it's really good to keep in mind what performance year and calendar year we're talking about. So performance year. So we are currently in the calendar year 2023. This is our 2023 performance year, began on January 1st, and again closes at the end of the year on the 31st. And this is just when clinicians are in their practices, taking care of patients and collecting all the different data throughout the year based on the different requirements for the performance categories. And then beginning January 2nd, 2024 is when that data submission period starts. So that is when clinicians are submitting their data that they need to CMS so that we can calculate those scores. And again, here we always like to encourage folks to submit data as early in that data submission period as you can. And we have a really great system online that as you're submitting data, you can see a lot of information as you submit data to CMS. And then that deadline will be April 1st, I believe. So between January 2nd and April 1st, you're going to be submitting all of this data to CMS. And then typically in the summer of 2024, we will provide performance feedback. So we take all that data and put together all of your costs or all of your score information and then release that in the summer of 2024. And then all of that information lets you know what your payment adjustments will be based on the scores that you received, whether you will receive a positive, a neutral, or a negative payment adjustment. And then those payment adjustments go into effect beginning January 1st of 2025. So our program, anytime you look at the program, it's typically overlapping or talking about 3 different years related to the same performance year. So performance year 2023, what we're in right now is related to payment adjustments clinicians will see in 2025. Next slide. So there are 3, this is important to know that there are 3 MIPS reporting options available for 2023. So this is new, this is different. We're really excited about it. So we stuck traditional MIPS, which is the original way clinicians have participated in MIPS since the start of the program. There's a wide variety of choice. They select quality measures and improvement activities from this big inventory we have of our measures and our activities. So there's a lot more choice there. And then beginning this year, this is the first year we have our MIPS Value Pathways available as an option for meeting your MIPS reporting requirements. And what MVPs are is you haven't heard anything about MVPs, in a nutshell, MVPs are a subset of measures and activities that we've grouped together around different specialties or medical conditions. And encourage folks, if you want to learn more about MVPs, we have in our webinar library, we have our past presentations that focus solely on MVPs for 2023. And then we have a really great section of our websites on qpp.cms.gov. We have an entire part of the website dedicated to MVPs. So encourage folks to check out all the resources and information there. And there are 12 MVPs available for 2023 that have been finalized. And a key thing to note is that if you do wish to participate in one of these MVPs for 2023, there is a requirement for advanced registration, which is open right now. So just encourage folks to go to the website and get more information about MVPs and how to register. And then our third option for MIPS is APP that we mentioned previously, so APM Performance Pathway. And this is a streamlined reporting option for MIPS APM participants that it's a specific measure, a set of measures that if you want to participate through the APP, you must report. And it's really designed to reduce reporting burden and continue to encourage participation in APM. Next slide, please. Okay, great. Well, now that we have the basics, we're going to dive more into the details about our improvement activities performance category. And I believe I am turning it over to Michelle Peterman.
Yes, thank you, Katie. Hi, everyone. I'll be walking us through the improvement activities performance category information. Next slide, please. So for the improvement activity basics for 2023, the goal for IA is to improve clinical practice, care delivery, and outcomes. They're identified under one of these 8 subcategories noted here on the slide. So all of them are separated out into these different subcategories. So for traditional MIPS, clinicians may choose from over 100 activities we have in our inventory currently. They are all intentionally broad, so many clinician types may choose and complete them. For MVPs, clinicians will select from a limited set of activities related to the MVP provided in the MVP. So we wanted to make sure you all take note of the information here in the box at the bottom. It provides information on how you can review the full list of activities on our QPP website. Next slide, please. So the reporting basic for improvement activities for traditional MIPS have not changed for 2023. The improvement activity performance category is 15% of the MIPS final score. The performance period is a consecutive 90 days between January 1st and December 31st. The activities are weighted at either medium for 10 points or high for 20 points. So a clinician can gain a maximum score of 40 points, which may consist of medium or high activities in any combination to reach the 40 points. In order to receive credit for completing an activity, the clinician must go into our reporting tool and attest to the activity during the data submission period. We recommend that clinicians maintain their supporting documentation for activities attested to for at least 6 years in case of an audit. And one note to highlight is that if you are reporting as a group, 50% of the group must attest to the same IA for 90 days within the same performance year. Next slide, please. So for the MVP reporting basics for improvement activities, they're very similar to traditional MIPS with a few caveats. So the performance category is worth 50% of the final score. Performance period remains the consecutive 90-day reporting period. Group reporting at 50% that I just mentioned. Same maximum score of 40 points, and the activity must be attested to. However, the difference in MVPs is that the activities are double weighted. So a medium weighted IA is worth 20 points and a high weighted IA is worth 40 points, which means a clinician may do fewer IAs reporting an MVP than compared to traditional MIPS. Next slide, please. So what's new with IA for 2023? So all of the changes that we made are primarily made to the IA inventory as noted here on the slide. We have added these 4 new activities. You can read them here: the adopting certified health IT, creating and implementing a plan for lesbian, gay, bisexual, transgender, and queer patients, creating and implementing a language access plan, and then also COVID vaccine achievement for practice staff. We also modified the 5 IAs that are noted here. And then we removed these 6 IAs in the far right column. Those, the new and modified activities help us to fill gaps identified in the inventory, while the removal of the 6 activities helps ensure that the inventory reflects current clinical practice. There were 3 IAs that were removed that were related to QCDRs noted here. But just a note that those still may be performed. They were just consolidated, and they can be attested to with PSPA 7. So that's still in our inventory and active and can be reported for 2023. Next slide, please. So each year we open a call for the activities and PI and activities where we accept nominations for new activities and modifications for our established activities that we consider for future implementation for the program. The call is open February 1st through July 1st, which means it's currently open right now. So when you submit a nomination for a new activity, these are the criteria that must be met in order to submit a nomination. So they must not duplicate other activities, must drive improvements that go beyond standard clinical practices, must be relevant to our existing subcategories. So they have to fit into one of those. They must show importance toward improved beneficiary health outcomes, must be feasible to implement, must have evidence to support that it will contribute to improved beneficiary health outcomes, must be linked to quality, PI, and cost. And then finally, it must be validated. So we have to have all 8 of these in order to consider the nomination. Next slide, please. These here are optional factors that we also consider. So we highly encourage that your nominations also include these 6 ideas, aligning with a patient-centered medical home. It could respond to a public health emergency that we've just all been through. Focus on meaningful actions from the person and family's point of view. Support for patient, family, or caregiver. Addresses improvement in practice to reduce healthcare disparities. And then finally, representative activities that multiple individuals or clinicians could perform. Next slide, please. Now we're going to be reviewing the IA participation requirements. Next slide, please. So for traditional MIPS, in order for clinicians to receive the highest score in the IA performance category, clinicians must attest to 2 to 4 IAs for a maximum of 40 points. So noted here, the medium IAs are worth 10 points in traditional MIPS, and the high weighted are worth 20 points. Next slide, please. So we also have something special statuses that get extra points in traditional MIPS. So folks, clinicians with special statuses are small practices, non-patient facing, rural health professional shortage areas. These IAs are weighted higher. So a medium weighted IA, as noted here, is 20 points, while the high weighted IAs are 40 points. Clinicians may check to see if they have a special status on our QPP participation status tool. It's important to note that if you're submitting data as a group, virtual group, or APM entity, special status designations must be determined at the group, virtual group, or APM entity level to qualify for the reduced reporting requirements. For example, excuse me, more than 75% of the MPI billing under a group's 10 must be designated as non-patient facing for the group to receive this special status. Next slide, please. For scoring, in traditional MIPS, if a clinician does not attest to performing any IAs, they will receive 0 points for the category. So the below is just giving examples of how you may achieve 40 points for IA. So the far left one is you could do 4 medium weighted. You could choose to do 2 medium weighted, as noted in the middle one, and 1 high. And the final right one, you could just do 2 high weighted activities, and that would give you your full points for improvement in activities performance category for traditional MIPS. Next slide, please. And then here for the special status designation, it's just showing that you really don't have to do as many activities if you weren't special status. So you'd only have to do 2 medium weighted activities for 40 points or 1 high weighted activity for 40 points. Next slide, please. So for MVPs, in order for the clinician to receive the highest score in the IA performance category, clinicians must attest to 1 to 2 IAs for a max of 40. As noted here, the medium weighted is 20 points, or the high weighted is worth 40 points. Next slide, please. And this one's just giving you a highlight of how that would look. So you do the 2 medium for 40, or the 1 high weighted for 40. Next slide, please. So this is highlighting our participation in the patient-centered medical home. So if you have that designation, if you are either certified or recognized as a patient-centered medical home, you can receive full credit in the IA performance category. You still would need to go in and attest to that, but you would be able to do that. So it's important to note that for organizations with multiple practice sites, at least 50% of the locations must be recognized or certified patient-centered medical homes or comparable specialty practices to attest to this. And as you can see by the designations below, you just need to do one of these criteria in order to have the PCMH designation. So either have received accreditation from an accreditation organization that is nationally recognized, be a comparable specialty practice that has received recognition through a specialty recognition program, be part of a Medicaid medical home or medical home model, or have received accreditation from another certifying body that certified a large number of medical organizations. Next slide, please. So for participation in MIPS APMs, I'm going to go very high level on this, but for APMs or MIPS APMs, they will automatically receive 20 points out of 40 under traditional MIPS or MVPs. MIPS APMs participants reporting via the APM performance pathway, or the APP it's sometimes called, will receive full credit. So it shows you a couple of examples here below of what is considered a MIPS APM. These are all included, these models. I'm not going to read them out. You all can see them. And then for APMs, it's the accountable health communities. So if you would like a comprehensive list, they're included in the 2023 IA user guide, which is right below here, and there's a link there. Next slide, please. We will now be reviewing the IA reporting and scoring. Next slide, please. Alrighty, and so to report completion of an IA, the clinician must attest during the 2023 submission period, which is January 3rd through April 1st of 2024. Clinicians do not need to submit any documentation when attesting for an IA. However, we do recommend that documentation be kept for at least 6 years in case of an audit. Documentation guidance can be found in the 2023 MIPS data validation criteria zip file. It provides further guidance. So in the box below, we have a few examples of the type of documentation that should be kept. For instance, like the left one, the screenshot, you could keep a screenshot, or the second one, improvement your plans that you've created, electronic health record. We also have a data validation criteria document that is on the QPP website that gives a lot of really good guidance on what type of activities you could do for a particular improvement activity, and also all the validation criteria of what you would need to keep or what we would be looking for. Next slide, please. This shows you how attestation data can be submitted. So there's these 3 different ways. So on the left, it's going to tell us who can submit these ways and how to submit on the right. So for a clinician, a practice representative, or APM entity representative, sign in and manually attest. It's very simple. You click a yes when you are attesting that you have completed an activity. The next way is a clinician, a practice representative, or APM representative, or third-party intermediary. They can sign in and upload a QPP JSON file with the activity attestations to our website. And then the third way is for third-party intermediaries. They may directly submit via computer-to-computer interaction using our QPP submission API program. Next slide, please. Okay, and lastly, this slide provides a visual example of the scoring for IA. So as we said before, IA is 15% of the MIPS final score. So IA takes the total number of points scored for a completed IA over the total number of points times 100. So the score is then multiplied by 15%, which is our category weight, as we've noted. And then it is added to the other performance categories to determine the MIPS final score. So I think it's pretty good representation on the slide of how that all works. All right, that wraps up the IA portion of the presentation. I will now pass the presentation over to my colleague, Elizabeth Holland.
Thank you, Michelle. I'm going to walk you through the Promoting Interoperability performance category. Next slide, please. Okay, so Promoting Interoperability is based on using certified EHR technology. Ideally, it enables patients to have access to their health information. It allows for the information of health information exchange between different healthcare providers. Next slide, please. Okay, so for 2023, Promoting Interoperability is worth 25% of your final MIPS score. And if you're in an APM entity, it's 30%. That's not minus 30, it's 30%, sorry. The performance period is a minimum of any 90 continuous days. You can choose a 91 day, a 275 day, whatever works best for you. Most of the measures are performance-based, and now we require the use of 2015 Cures Edition Update Certified EHR technology. If you do not have that, you will get 0 points for PI. Next slide, please. Okay, so now we used to have flexibility to use different editions, but now you must use the 2015 Edition Cures Update. For our public health and clinical data exchange objectives, we used to have 3 active engagement options. We have collapsed options 1 and 2 into a new option called pre-production and validation. And we renamed the 3rd option to be called validated data production. In addition to the new options, you must submit your level of active engagement. So you will either tell us that you're at pre-production and validation, or if you're at the validated data production. Really, the goal here is to determine if people are being stuck in pre-production and validation so that we can work with the Centers for Disease Control and Prevention and local health public health agencies to try to make sure that everybody gets to the validated data production stage. Starting with 2024, you're only going to be allowed to spend 1 performance period at the first option. So you can stay in pre-production and validation for 2023 and 2024, but in 2025, you must be progressing to the validated data production. The only exception to that is that if you totally switch registries, so if you're reporting to one immunization registry and decide you're going to switch to a different immunization registry, you would be permitted to go back and have a year again at the pre-production and validation stage. Next slide, please. A couple other new changes for 2023. We have updated our query of prescription drug monitoring program, or PDMP measure. It is now a required measure. We also changed to add exclusions because it is required. So people can, if they claim an exclusion because they qualify for it, then they would fulfill the measure in that way. In addition, we have expanded the scope of the measure, so it doesn't only include Schedule 2 opioids, it also will now include Schedule 3 and Schedule 4 drugs. In addition, we added a 3rd option to our health information exchange objective. That is enabling exchange under the Trusted Exchange Framework and Common Agreement, or TEFCA. So that if you attest yes to that, you would fulfill and get the full points for the health information exchange objective. Starting in 2023, we have discontinued the auto reweighting for nurse practitioners, physician assistants, certified registered nurse anesthetist, and clinical nurse specialists. The only, we are still reweighting other clinician types, but For these, they've been reweighted since the beginning of the quality payment program, and we believe they now have enough experience and should be reporting on promoting interoperability. In addition, we've updated the submission requirements to allow APM entities participating in MIPS at the APM entity level, the option to report for promoting interoperability at the APM entity level. Of course, you'll still have the option to report promoting interoperability at the individual or group level if you so choose. Next slide, please. Okay, so one of the other changes we made for 2023 is we reallocated all the points for all the different measures. Part of this was because we moved query PDP from an optional measure to a required measure. And the other reason is because we're putting an emphasis on public health and clinical data exchange reporting. We think it's really important, especially through things we learned during the public health emergency. And so we reallocated the points. The points now add the required points add to 100. And if you report on one of the additional public health measures, you can earn 5 bonus points. It doesn't matter if you report on 1, 2, or 3. You can only earn 5 bonus points. Next slide, please. Okay, so there are many reasons why you may not have to report on the promoting interoperability performance category. One, you are a clinician type that automatically qualifies you for automatic reweighting. You are ambulatory surgical center or ASC based, you're hospital based, you're non-patient facing, or you're a small practice. So I know there were some questions about the small practices. It's 15 or less clinicians in the practice. And yes, you used to have to file a hardship exception. You do not do that anymore. You're automatically reweighted. However, if you by accident submit data for the promoting interoperability category or submit some data, your automatic reweighting will be canceled. And the other reason we would reweight you is if you have an approved promoting interoperability performance category hardship exception. And I already discussed the APMs. So next slide, please. Okay, so here are the reasons why you could submit a promoting interoperability hardship exception application. First, you're using decertified EHR technology. You have insufficient internet connectivity. You experienced an extreme or uncontrollable circumstance. So that could be, for example, a hurricane or tornado, something like that, where you're not able to submit for the category. And the third is if you lack control over the availability of CERT. If you're in a large practice, for example, and the practice administrators choose not to have CERT, then you obviously cannot submit for promoting interoperability. So that would mean you could qualify for that hardship. And when you submit your hardship application, you have to claim a reason, one of these reasons. APMs are not able at this time to submit a promoting interoperability hardship exception at the entity level. And as Katie mentioned before, the hardship exception application is now open and will be open for quite a long time. Next slide, please. Okay, now we're going to go into reporting and scoring. Next slide, please. Okay, so we have 4 scored objectives: e-prescribing, health information exchange, provider to patient exchange, and public health and clinical data exchange. Now, depending on how you report, you either have to do 6 or 7 required measures. That's because there's an option of 2 health information exchange measures or 1 of either the bidirectional exchange or the TEPCA measure. Next slide. Okay, so as I mentioned before, you need to have the 2015 Edition Cures update certification criteria. The functionality must be in place on the first day of your selected performance period. So that could be as late, I think, as October 2nd, 3rd, or 4th, something around there, where you would get 90 days in the calendar year. Your certified EHR technology must be certified by the very last day of your performance period, which could be potentially the last day of the year. Okay, next slide, please. Okay, so you must submit data for all the required measures. And so there are scored measures and there are unscored measures. The unscored measures, if you do not fulfill them, you will still fail PI and get a score of 0. So you must submit your EHR CMS certification ID. You must attest yes to that you have not taken action to limit or restrict the compatibility or interoperability of your certified EHR technology. Yes to the ONC direct review attestation. Yes to the security risk analysis measure. And yes or no to the high priority practices guide of the safety assurance factors for EHR resilience or SAFER guides. And again, you must submit your level of engagement for the required public health and clinical data exchange measures. Next slide, please. Okay, so this just walks through what I just talked about. The newest measure here is the SAFER guides. The other measures have been part of promoting interoperability for quite a while. Next slide, please. Okay, so these are the objectives and measures. And so as you see, required measures do have, generally do have exclusions, except for the provider to patient access measure. That does not have a measure because you just, right now the measure does not require the patients to actually access their data. You just need to be able to give them access so they could access it through a portal or an API if they so wish. Next slide, please. Here you see the options for the health information exchange. If you choose the first two, the support electronic referral loops 2 measures, you must do both of them, or you could do the HIE, or you could do the TEFCA. Next slide, please. And here you see the 2 required public health and clinical data exchange measures, electronic case reporting and immunization registry reporting. And then again, the 3 optional where you could possibly earn the 5 bonus points. Next slide, please. So to calculate the your final promoting interoperability score, as I mentioned, it's 25% of the MIPS score. There are 105 points available, but it is capped at 100. So we would take the number of points that you earn and multiply it by the category weight. Next slide. And so there you see for each measure, e-prescribing, you submit your numerator and denominator, and if that will be calculated into points, and then we'll sum all the points up for the required measures. Next slide. Okay, so there are exclusions, and there are different things that happen for public health. If you do submit an exclusion for one of the required measures and a yes for the other, you would still earn the 25 points for the public health and clinical data exchange. If you claim 2 exclusions, those 25 points will be redistributed to the provide patients electronic access to their health information measure. And if you're unable to report and you don't claim exclusions, you will get a 0 for the public health and clinical data exchange objective, and you will get a 0 in promoting interoperability overall. So anytime you do not fulfill a requirement, a required measure, you will earn a score of 0 in PI. Next slide, please. So here again, these are where you could earn bonus points. Next slide. Reweighting, next slide. So we touched on this a little bit. So you're required to report on the Promoting Interoperability performance category unless you are a certain type of clinician, you have a special status, or you have a hardship exception. And if you do get reweighted, your Promoting Interoperability will be 0, and you will be the 25% will be redistributed to another one of our performance categories. Next slide, please. So these are the clinician types that will be automatically reweighted for 2023. And again, in the bottom right are the special statuses that will also earn you reweighting automatically. These are all automatic. Next slide, please. Again, this is just the same, making the same point in a different way. And again, as I said, small is defined as 15 or fewer clinicians. Next slide, please. And so there's different ways you can submit your data. You can sign in and attest. You can upload your data, or you can do a direct submission using an API. Next slide, please. And now I'm turning it back to Katie Moore.
Great, thanks, Elizabeth. Okay, we can go ahead to the next slide. So the next few slides are just some helpful resources and things you might be should be thinking about at this point in the performance year. So we thought it'd be helpful to put together kind of a checklist on what you should be doing. So we encourage folks to check out first. You always want to see what your participation status is in the program. So there's a really easy to use tool on the QPP website that you enter your NPI. So you enter your NPI, and then it'll let you know your status in the program. We have an Explore Measures and Activities tool that helps you search through all the different measures and activities in our inventory and gives you some great details in those. And then we also have an Explore MVPs tool. So this helps you search through the 12 finalized MVPs that are currently available, lets you know what measures and activities are included in each of those, and determine if they apply to how you practice. And then, as always, we have our QPP resource library that is our one-stop shop for all of our fact sheets, user guides, resources, and then we also have a webinar library that where we host all of the videos and recordings and slides from past presentations. So if you want to go back and refer to anything we've talked about today, we'll have these slides posted in the next couple of weeks as well. So encourage folks to check out all the information there. If you're included in MIPS, or if you are choosing to opt into MIPS, want you to learn more about MIPS, the reporting options. I know we touched on the 3 options today, but there's a lot more information on our website. And as always, we have our QPP Service Center is available Monday through Friday, 8 to 8, to answer any questions you may have, whether it's getting started in the program or more of a technical participation question. They're a wonderful resource, and our agents are very knowledgeable and connect with CMS staff regularly to make sure folks are getting the information that you need. Next slide, please. And I know we touched on these a little bit. Just wanted to highlight again our annual call for measures and activities. So the call for cost and quality is available for a few more days, so until the 19th. And then promoting interoperability and improvement activities, we have a little bit more time till July 1st, but more information in our call for measures and activities documents is available. Next slide. And here's just some more details. I mentioned briefly that if you are intending to participate in MIPS through an MVP, that is wonderful. We're really excited to have that available this year. but you do need to register. So it is open right now. And just want to let folks know we received some questions. So the process this year for registration for MVPs will be a manual process. We have a form, just an Excel spreadsheet that is really easy to fill out and submit. And we have a great video that walks you through all of the steps to fill out the form and how to submit it and everything you need to know about that. But we do intend to incorporate it into our login experience next year, but just wanted to flag that there is that difference this year, but it is available right now and you need to register. You have until November 30th to register. And again, Service Center is available if there are any questions related to the form or anything related to MVP registration. Next slide. And our other registration that is open right now is CAHPS or MIPS survey, and that is through June 30th. They have a little bit more time to think about that option. But again, we have resources on our website that can tell you a little bit more about CAHPS or MIPS survey and then how to register. Next slide. And here we just compiled some helpful resources. So a lot of our quick start guides are available. We have the entire improvement activities inventory available, some data validation criteria. We get a lot of questions around those, and then our different more detailed user guides and measure specifications. So encourage you to check out our resource library. Next slide. Okay, before we hop into the Q&A, I know I saw a number of questions around the EUC and hardship, PI hardship applications. I just wanted to make sure folks knew that yeses are available, and if you apply and have an approved application, but you still later, during data submission period, you are able to submit data and choose to, then we do score that information. So if you do have an approved application, but you submit 2 or more categories worth of data to us, that will basically cancel out your EUC application, because if you submit for 2 performance categories, that tells us that you are able to and intend to participate in the program. So you will be scored on that information and have the associated payment adjustment related to that. Okay, I'm going to turn it back over to our Ketchum team to go through, walk us through how our Q&A is going to go.
Sure. Thanks, Katie. Yeah, so we're now going to start the Q&A portion of the webinar. And for this Q&A, you can ask questions through either the Q&A box or through the webinar audio. And ask a question through the webinar audio, please do raise your hand and we'll unmute your line so that you can speak. And also just to note, since this webinar is focused on improvement activities and promoting interoperability, we're only going to be addressing questions pertaining to those performance categories. Okay, so to start us off, we are going to go to the Q&A box, and our first question asks if we need to apply for the COVID exceptions in 2023 now that that is no longer automatic.
Yes, so I think part of the question was asking if it was no longer automatic. So just want to make sure that that part is clear first. So in 2019, 2020, and 2021, when we were really in the midst of the public health emergency, we did apply our automatic EUC exception across the board to all MIPS individuals eligible clinicians due to the COVID pandemic. However, for 2022 and 2023, the automatic EUC exception is not applied across the board for everyone, but we do have the application available. So for 2023 still. So yes, you would need to submit an application and request reweighting.
Great, thanks. So the next question reads, what is required to meet the query of PDMP measures And is having the ability to electronically run a query of prescription drug monitoring programs enough to meet, or does something need to be documented or attested to at certain levels?
For the query of PDMP measure, we only require you to do one query of a PDMP. That's it. And it doesn't have to be, you should use the data from the EHR, but the PDMP does not need to be linked to your certified EHR technology.
Great. Okay, we're going to turn our attention over to the audio. Alexandra Woodward, we've unmuted your line, so go ahead and ask your question when you're ready.
Hi, thank you so much. Regarding the MIPS Promoting Interoperability Performance category measure submission process, is that process separate from the Medicare Promoting Interoperability Program measure submission process for eligible hospitals and critical access hospitals? And are both measure submissions due on July 1st through separate processes?
Nothing is due on July 1st. Are you talking about the hardships or are you talking about the data submission?
I thought there was a slide that said that there was a measure submission process or measure submission.
That's the call for PI measures, Elizabeth.
Okay.
Yeah,
So there are two different call for measures.
okay,
And the one we're talking about here is the one for promoting interoperability performance categories.
okay,
Basically, they all come to me. So, I mean, there is one open also for hospitals right now.
okay,
I think it closes a little bit later. And
Okay.
so you could submit the same thing to both if you so desire, but
Okay.
that's how it works. Okay.
okay.
Does that
Great.
help?
Yes, thank you so much.
Great, thanks. Okay, so we're going to go back over to the Q&A box. Elizabeth, we did get one comment asking for clarification around the new enabling exchange under TEFCA measure. Would you be able to provide a quick overview and if it's required in addition to the other measures under the HIE objective or an alternative?
It is not required. It's one of the alternatives. So you can either submit the two support measures, or you can submit the bidirectional exchange measure, or you can submit the TEFCA measure. And TEFCA is something that's being sponsored by the Office of Health Information Technology, or ONC, and they just chose 6 or 7 entities that are going to be the first to launch the ability to participate in TEFCA. But our understanding is at this time, they're not actually going to be live till late in this year. So I would think for 2023 that nobody is going to be able to fulfill the TEFCA measure, which is unfortunate. We didn't know that when we actually finalized this. We do have lots of information on TEFCA, the TEFCA measure in our resource library, and I think they've already, if we haven't, we have put the link in the chat. We can certainly add that, but it is in the Promoting Interoperability specification guide. There's a whole specification sheet dedicated to the TEFCA measure.
Great, thank you. We're getting a few safer guides questions. Can you just clarify again the requirements for 2023?
So for the safer guide, all you need to do is review the high priority practices guide. You either review it or you don't review it, because for 2023, you can either submit a yes or a no and still get credit for that measure.
Great, thanks. Okay, so yeah, I just want to remind everyone attending to submit questions through the Q&A box, or if you do have a question you'd like to answer live, to just raise your hand and we will call. See. Gonna give it a little bit longer to see if any questions come in. Okay, it looks like we have one question on the audio. Crystal Austin, we have unmuted your line. So whenever you're ready, go ahead and ask your question.
Hi, thank you. I just wanted a little bit of clarification about the PDMP measure. I know someone asked earlier, and I think the response was that the provider just needs to query the PDMP once. So does that mean that like them putting in like 1 out of 1 is fine? There's no minimum for it
It is actually a yes/no measure.
for the PDMP for this year?
Yes.
Okay, thank you so much.
Mhm.
Okay. Janetta Wilburn, we just unmuted your line. So go ahead and ask your question whenever you're ready. You may need to unmute your line on your end. Okay, we're gonna give it a few more minutes or a few more seconds. Okay, looks like we have another question from the Q&A box. This one asks, are there any exclusions for electronic case reporting, and can you review the levels of engagement?
Yes, there are exclusions for electronic case reporting. I think there's 2 or 3. And you either need to be in option 1, that's pre-production and validation, or validated data production, which means you're submitting data to the public health registries on an ongoing basis.
Great, thanks. And another one asks, for PDMP, can you clarify what you mean by it doesn't need to be linked to the EHR?
We understand that many EHRs do not have the functionality to connect to the PDMPs directly. So it means going in and finding an instance where you have prescribed a Schedule 2 opioid or Schedule 3 or 4 drug, and then for that person conducting the query of the PDMP, which is probably outside of the certified EHR technology.
Great, thanks. Again, if you do have a question, please make sure to put it into the Q&A box or to raise your hand and we will unmute you. Does look like we have a couple more questions coming through on the audio. Jane Swalzer, we just unmuted your line. So whenever you're ready, go ahead and ask your question.
Yes, thank you. We service primarily nursing homes, and many of them are dementia residents. To meet the provider to patient exchange, if we create a letter to the nursing home facility outlining the steps involved in how to access our EMR patient portal, will that suffice to meet this measure?
Yes, that would be fine.
Thank you.
Okay, Janetta Wilburn, we're gonna go back to you. We're gonna unmute your line. So whenever you're ready, go ahead and ask your question. It does look like you're muted. You might need to unmute your line on your end.
Can you hear me now?
Yes.
Okay, perfect. Thank you so much. I just wanted some clarification about the PDMP measure. Our company is large and we have locations throughout the US. I know there needs to be just one query. Is that per group or per provider? Because we typically report as a group.
If you report as a group, it's 1 per group.
Okay, great. Thank you.
Mhm.
Great, okay. See, we give it a few more minutes to see what other questions come in. It looks like we have some more audio questions coming in. Joanne Zhao, we're going to unmute your line. Go ahead and ask your question. Does look like you're muted, so you might need to unmute yourself.
Hello, hi, can you hear me?
Yes.
Yes, I just want to clarify this answer. You said you only need to show one per group for query PDMP. What does that mean? Does that mean that only need to happen once during the reporting period?
Yes, so if you're submitting as a group, so all your data for the group is coming together, there would only need to be one query of the PDNP to fulfill the measure.
Okay, so for us, we enable the, for example, when provider was prescribing one of these schedule 2, 3, or 4 drugs, we would remind them to query PDMP and let them attest, yes, I did. Would that be sufficient to show the auditor that we fulfilled it in future?
Yes.
Thank you.
Great. Okay, we do have another question from the Q&A box that asks if you can explain bidirectional HIE.
Essentially, it means that you can send information and you can receive information from the HIE. So if you're putting your information out through a health information exchange network, you're able to also pull in information from other providers and entities into your EHR.
Great, thanks. Okay, we're going to turn our attention back to the audio. We have Jessica Scarcliffe. Go ahead and ask your question whenever you're ready. Jessica, you may need to unmute yourself on your end. Okay, we have another question from the Q&A box, and it asks for the HIE bidirectional exchange. Does that need to be done for at least one patient to attest?
No, ideally it's turned on for the whole reporting period.
Great, thanks. Okay, we have another question from the Q&A box asking if there's an exclusion for query PDMP if the state does not have a PDMP.
Yes, there are exclusions available for the measure because it is now required.
Thanks. And we're going to go back over to the audio line. Mindy Webenmeyer, we just unmuted your line, so go ahead and ask your question whenever you're ready.
Hi, yes, can you hear me?
Yes.
Okay, so we are in the process of changing EHRs. The conversion will be complete around August. Does that mean we submit information out of both EHRs separately?
It would really depend on what your performance period is going to be.
Well, I think the first 2 quarters will be in our old and the second 2 quarters will be in the new, potentially.
So for promoting interoperability, you could choose a 90-day period in the second in your new EHR and report,
Okay.
just report for that period.
Okay, and then for like our quality, we'll have to report out of both, correct?
That I'm gonna phone a friend.
Okay, thank you.
Who can answer that for quality, guys?
Yes, she will.
Okay, report out of both for quality, and then improvement, we can report our last 90-day period out of our new EHR.
Yes, because it has a 90-day reporting period as well.
Thank you.
Great, thanks. Great, we're gonna give it a little bit longer. If you have questions, please be sure to send them in through either the Q&A box or raise your hand and we will unmute you. Okay, we had a question just come into the Q&A box. This one says, for the immunization registry, is that for patients only or is staff included? For example, if we give the hepatitis vaccine series to a new employee.
The measure requires that the data for your immunizations get submitted to an immunization registry. So if you are conducting those immunizations of patients and of staff, all that could be included. And just, I want to clarify something on the query of PD&P. There are 3 exclusions. And if it is a situation where you do not prescribe any Schedule II opioids or Schedule III or Schedule IV drugs, you would claim the exclusion number 2, which is writes fewer than 100 permissible prescriptions during the performance period. I know that's a little confusing, but that is the one that we are telling people who do not electronically prescribe. There was another question about paper opioid prescriptions. This is only the PD&P measure only applies to electronic prescriptions.
Great, thanks. Okay, we're going to give it a few more minutes for additional questions to come in. Again, either submit a question if you have one through the Q&A box or raise your hand and we'll unmute you.
I'm just going to answer another question. People are asking for what documentation to have in case of audit. We do have a data validation sheet on our resource library, and that walks through each measure and what we recommend retaining in case of audit.
Great, thanks. Okay, we do have a question that popped up in the Q&A box, and this one says, it says 5 bonus points available for promoting interoperability by submitting yes for 1, 2, or 3 of the optional PH and CDE registries. Does that mean only one will give full 5 points?
Yep, only one.
All right, do another scan for additional questions. I think we're going to give it a few more minutes, and if nothing new comes in, I do think we are going to wrap today's webinar up. Okay, so we have another question that just popped up in the audio. So Sydney Sit just unmuted your mic, so feel free to ask your question. It does look like you're muted though, so you may need to unmute your mic.
Can you hear me?
Yes.
My question would be is for the safer guy, because last year that you have the option is just to answer yes or no, and it is a no effect in terms of the scoring. So is it the same for this year?
Yes, it is the same. Yes or no will fulfill the measure.
Okay, thank you.
Mhm.
Okay, Paul Perryman, we've just unmuted your line, so feel free to ask your question whenever you're ready.
Could you just explain the differences other than the reporting record about the MVP versus traditional MIPS? And I want to say I heard that with MVP, you have to report it's either improvement activities or PI, but you don't with traditional MIPS. And I'm a small practice, just one solo guy. So can you help me with that? Were you able to hear me?
Yeah, is there somebody who could jump in on that question?
Hey, Paul, thanks for asking. Yes, sorry, I was trying to see if we had any of our other MVP experts on, but yes. So MVPs is both options. You still report on all 4 performance categories. It's just within MVPs, there's a smaller set of measures and activities that are specific to whatever the specialty or condition is that the MVP is related to.
But I was told from my vendor that there was something that they said that you have to do with MVP that you don't have to do with traditional MIPS, and I can't remember which category it was in. But it sounds like if I'm small practice, I don't have to do PI anyway, right? So,
Correct.
That's correct.
Yes.
The requirements for PI are the same under MIPS and the same under MVPs.
okay. But otherwise, they're the same as far as other than the requirements for the quality part. And I guess, well, I know there's differences, but you still have to do the improvement activities for both, correct?
Right. You would do the improvement activities that are associated with the particular MVP that you choose.
Okay. All right. Thank you.
Okay, we have one final question that just came in, and this one asks, is there a current CMS reference on suggested audit materials for MIPS PI attestation?
Yes, on our resource library, we have a data validation document, and it does list for each measure the recommended materials that you should retain in case of audit. Definitely check out that resource library. There's a lot of information there.
Yeah, and just to add, this is Michelle. We have it also for improvement activities as well.
And if you just, when you go to the resource library, if you just in the search bar, if you just type in validation criteria, it'll bring up the zip file that we put it all in one place. It's one zip file that includes the validation for improvement activities, quality, and PI.
Great, thanks. Okay, so that concludes the Q&A portion. We are now going to turn it back over to Katie to wrap up the webinar. Katie?
Okay, great. Thanks, Matt. And thank you, everybody, for all of your great questions and participation today. So really appreciate it. Also want to flag that in 2 weeks, we have another webinar that will focus on our quality and cost performance categories. So encourage folks to join us again then. Thank you. Have a great rest of the day.